So when we look at this picture, this is a picture that describes the slide here. On the edges, on either side, I have two sheets of embryonic tissue. In this case, it's mesenchymal tissue. So mesenchymal tissue and mesenchymal tissue. In between, I'm going to develop the actual bone inside. So this is showing the same thing. I have mesenchymal tissue and mesenchymal tissue that's now covering or supporting the development of this purple structure, which is forming my spicules or trabeculae, which is the functional pieces of spongy bone. So as we go through the steps, pretty simple. Mesenchymal cells are going to differentiate into osteoblasts. Remember, we do have osteoprogenitor cells, and osteoprogenitor cells are our stem cells for bone. So we will see sometimes where the mesenchymal turns into osteoprogenitor and then osteoblast. But a lot of texts will say that it goes straight from mesenchymal to osteoblast to start secreting that matrix. And when we talk about secreting the matrix, it's creating the bone within spongy bone. So osteoblasts differentiate and turn into osteocytes. Now we have the specialized cells that help create the actual matrix to give me the functional pieces of spongy bone. In this case, it's spicules, just the little struts, almost like individual branches, and then they become the tree, which is trabeculae. So as I look at these are like individual spicules. Here's one here forming here to connect to here, to here, to here, to here, and all of this becomes trabeculae. This is then we start to form spongy bone. So this is basically baby spongy bone. Now it could turn into compact bone and change depending on where it's at and the type of bone as it develops. It just depends on the point of development. Key difference though is we don't see hyaline cartilage, and that's where we moved into endochondral ossification